This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome to the 21st Century Man podcast. Today, we're embarking on a really crucial deep dive. We're looking at Chapter 95 of the 21st Century Man book.
That's right.
It's called Staying Fertile, and it's written by the very highly respected Dr. Philip E. Werthman.
A fantastic chapter.
Yeah, and our mission today really is to unpack this chapter, pull out the most important, nuggets of knowledge and some truly actionable insights. We want to help you navigate what can often feel like a pretty complex, maybe even daunting topic.
Absolutely.
This book is just such a practical guide for modern life, and, well, this chapter offers some invaluable wisdom.
It's such an essential discussion. I mean, male fertility is a huge piece of the conception puzzle, but it often gets overlooked, doesn't it?
It really does.
So today, we'll be breaking down what infertility actually means, looking at the factors that influence it, some might surprise you, and demystifying how it's tested.
Okay.
And crucially, outlining the steps you can actually take to preserve and maybe even improve fertility. We'll even touch on some cutting-edge tech.
Sounds great.
Yeah, it's a topic that touches so many lives. And Dr. Werthman's insights, they just bring such clarity.
Okay, let's unpack this then. Get right into it. So, when we talk about infertility, the clinical definition is actually pretty straightforward.
Right.
It's basically the inability of a couple to get pregnant after 1 year of unprotected intercourse.
1 year, that's the standard time frame.
Exactly. Now, for lots of couples, conception happens pretty quickly. The data shows something like 50% conceive within 3 months.
Half in 3 months. Right.
70% within 6 months, and about 85% within that first year. And that's all without any specific treatment. And even for the other 15% who don't conceive in that first year, about half of them will still get pregnant in the next 12 months.
So patience can sometimes be key too.
It seems so.
Yeah.
But here's the really critical insight, I think. In roughly 1/3 of couples facing infertility, a male factor is a significant contributor.
1/3. That's huge. It
Yeah.
really underlines that it's not just a female issue, like you said.
Yeah. In the U.S., for example, about 12% of men aged 15 to 44 experience some kind of fertility issue.
And what's really illuminating there is just how often male fertility is a key part of the equation, yet, the focus so often just defaults to the female partner.
Right.
And while it's true men can father children, well, quite late in life, I mean, there are documented cases of men in their 80s, the fertility rates do seem to be lower in men over 40.
Okay, so there is an age factor for men, just maybe less dramatic than for women.
Exactly. But the most critical determinant, the number one factor for a couple's reproductive potential, hands down, remains the age of the mother.
Her age is paramount.
It really is the dominant factor. And sort of shifting to a bigger picture, something quite concerning, is this reported worldwide decline in sperm counts over the last few decades.
I've heard about that. Is it definitively proven?
Well, the data suggests a strong trend. And when we break down the primary causes of male infertility, Dr. Werthman highlights that a whopping 75% are due to testicular issues.
75%.
Yeah, that includes genetic factors too. This dominance of testicular factors suggests that, while lifestyle definitely plays a role, sometimes the underlying machinery itself needs the most attention.
Okay.
Hormonal imbalances and blockages in sperm transport, they each account for about 5%. And then there's this tricky 15% that falls into the unknown causes category.
That 15% must be frustrating for couples.
It really can be.
Okay, that helps put the overall landscape into perspective. Now, let's pivot to something maybe more in our control. Lifestyle and environmental factors. These play a surprisingly big role, don't they?
Huge role. Absolutely.
Take smoking, for instance. The data seems pretty clear on this one.
Oh, crystal clear. Cigarette smoking negatively impacts sperm counts. It increases harmful free radicals, and it can lead to sperm DNA fragmentation. Just bad news all around.
And it's not just cigarettes, is it? The chapter mentions other things.
Right. Broader drug use, alcohol, marijuana, opioids, even things like exposure to radiation, chemotherapy, or certain toxic chemicals can seriously hamper fertility. And Dr. Werthman specifically points out that opioids and cannabinoids, they can cause low testosterone and, well, consequently, infertility.
Right, that connection is important.
And speaking of testosterone, this is something Dr. Werthman really emphasizes, and it's critical. Taking testosterone itself.
Like supplement or steroids.
Exactly.
Hmm.
Whether it's prescribed by a doctor or, illicit anabolic steroids, administering testosterone drastically reduces sperm production. Often, it stops it completely.
Wow, completely.
Often, yes, temporarily at least. It effectively acts as a male contraceptive. So if you're trying to conceive, testosterone is absolutely out.
That is a vital takeaway. Okay, shifting to physical factors. Varicoceles? How do you say that?
Varicoceles, yeah. They're basically varicose veins, but in the testicles, like the ones people get in their legs.
Got it.
And they're the most common correctable cause of male infertility. That's the key word, correctable.
So what do they do?
They can reduce sperm quality, cause DNA damage, lower sperm production. Basically, they create a poor environment down there. But the good news, like the chapter points out, is that sperm quality and pregnancy rates usually improve significantly after a minor procedure to repair them.
That's really positive news. What about obesity?
Another significant factor. It's not just about general health. Obesity leads to lower testosterone and higher estrogen levels.
Okay.
Both of those hormonal shifts directly impact fertility. Plus, that extra body fat can act like an insulator, actually increasing the temperature around the testicles.
Ah, the heat factor again?
Exactly, which, as we'll discuss more, isn't great for sperm production. Then you have environmental toxins, the pesticide dibromochloropropane, that's a well-known one. Heavy metals, too, like lead, cadmium, mercury.
Stuff you might encounter occupationally.
Sometimes, yeah. And there's this growing concern about endocrine disruptors, chemicals in the environment that mess with hormones, and how they might be contributing to that worldwide decline in sperm counts we mentioned earlier.
It's a complex web of factors.
It really is. And general heat exposure is another big one. Just prolonged high testicular temperature can definitely affect sperm quality and production.
So what kind of heat are we talking about?
Well, it's not just obvious things like saunas or hot tubs. Those certainly can reduce sperm counts temporarily.
Right.
It also includes occupational exposure. Think about jobs involving prolonged sitting, like truck driving, or working in hot environments, like welding or baking.
Okay, so it's about sustained heat. What about just a hot shower?
Interestingly, hot showers are generally considered fine, so no need to switch to cold showers just yet.
Okay, good to know. What about technology? Laptops, phones?
Yeah, this is an area of research. Lab studies have shown that heat from using a laptop directly on your lap can be an issue.
Yeah.
And some research even suggests Wi-Fi itself, even without the heat, might have adverse effects.
Really? Wi-Fi?
In lab settings, yes. Cell phone usage is still a bit controversial. There's ongoing debate about whether keeping to your front pocket has detrimental effects on sperm. The jury's still out on the definitive impact there.
Okay, something to be mindful of, perhaps. And one last factor here. STDs.
Sexually transmitted diseases. Dr. Werthman calls these the most preventable cause of infertility.
Most preventable. That's key.
Absolutely. Untreated STDs, like chlamydia or gonorrhea, can cause inflammation and scarring in those tiny, delicate sperm ducts. This can lead to blockages or just severely impact sperm quality. It's a really powerful reminder about safe sex practices for long-term reproductive health.
Definitely. Okay, now let's maybe peel back another layer and dive into some of the biology and genetics behind this that Dr. Werthman explores. This stuff is fascinating.
It really is. When we talk about aging and fertility, it all comes back to this really complex, finely tuned system called the hypothalamic-pituitary-gonadal axis. HPG axis for short.
PG axis, okay?
Think of it like your body's master control panel for reproduction. It's the sophisticated communication network, right, between your brain, the hypothalamus and pituitary gland, and your testes.
Brain and testes talking to each other.
Essentially, yeah.
Yeah.
This system regulates everything from testosterone levels to sperm production. As men get older, you often see testosterone levels naturally decrease, and that's frequently due to subtle changes or, let's say, irregularities within this HPG axis communication.
Wow, it's incredible how interconnected it all is. The chapter also defines a term, azoospermia. Sounds technical.
It does sound a bit esoteric, but it simply means the complete absence of any sperm in the ejaculatory fluid. It's detected in about 1% of men during a semen analysis.
1%. So not super common, but significant if it's you.
Exactly. And it usually stems from one of two main issues. Either there's a physical blockage somewhere in the reproductive tract, so sperm are being made normally, but they're trapped.
Okay.
Or the testicles themselves just aren't producing enough sperm, sometimes none at all. That's called testicular failure.
Right. That sounds quite final testicular failure.
It sounds daunting, but here's the reassuring news. And Dr. Werthman makes this point very clearly. Most men, even those with really severe sperm production problems, often still produce some small quantity of sperm,
Oh.
which means with the help of advanced reproductive technologies, they can often still father their own biological children. That offers immense hope.
That is huge. Absolutely huge.
And speaking of these more severe cases, certain genetic issues can definitely cause male factor infertility. Things like Klinefelter syndrome that's having extra X chromosome. It's surprisingly common, actually. Affects about 1 in 400 men.
1 in 400. Wow.
Yeah. Then there's Y chromosome microdeletion, where specific genes needed for sperm production are just missing from the Y chromosome. And also congenital absence of the vas deferens, or CBAVD, where part of that sperm transport tube, the vas, is missing from birth, causing a blockage.
Okay.
But the crucial takeaway here, which the 21st century man really articulates well, is that even with these conditions, the vast majority of men can still become fathers, provided they get the right diagnosis and appropriate treatment.
That really highlights the amazing advancements in the field, doesn't it?
It's incredible. It truly is.
And then there are congenital issues, things you're born with, like cryptorchidism.
Right. Cryptorchidism is being born with an undescended testicle, or sometimes both. It's quite common.
Okay.
And it's strongly linked to potential fertility problems later in life. The chapter really stresses how important early recognition and surgical correction is, ideally before age 2.
Before age 2, that early.
Yes. Acting that early can make a profound difference in preserving future fertility potential. It really underscores the lifelong impact of good early pediatric care.
Absolutely. Okay, so if someone suspects there might be an issue, or they're just starting the journey, what does the testing process look like? The semen analysis seems key.
It's the bedrock, really, the foundational lab assessment for the male partner. Dr. Werthman explains you typically need to provide 2 samples.
So 2? Why 2?
Because sperm counts and other parameters can fluctuate quite a bit day to day. So 2 samples, collected after 2 to 7 days of ejaculatory abstinence.
Okay, specific window there.
Yes, and collected at least 1 week apart to get a more reliable picture. Now here's a really critical clarification from the book.
Yes.
A semen analysis is not a definitive yes or no fertility test. It doesn't say you are fertile or you are infertile.
Right, it's not black and white.
Exactly. It provides a rough idea, a snapshot. You could have a perfectly normal count on paper and still struggle with infertility for other reasons. And conversely, someone with an abnormal analysis might still go on to father children naturally.
So it's a screening tool, essentially.
A very good initial screening tool, yes.
Yeah.
But just one piece of the puzzle.
Got it. So what does it actually measure?
Several key things. First, sperm shape or morphology. And what often surprises people is that human sperm are, well, notoriously imperfect.
Imperfect.
Yeah. It's completely normal for the vast majority, often around 85%, to be abnormally shaped.
85% abnormal is normal.
That's average, yeah. Fertility might be reduced if that percentage creeps higher, say above 95%, but fertilization can still happen, even with up to 96% abnormal forms.
Wow. Okay.
Interestingly, sperm motility, how they move, while it seems obviously important, it's actually the least predictive factor of fertility potential when looked at in isolation.
Really? Movement is least predictive. That's counterintuitive.
It is a bit. But speaking of movement, typically you want to see more than 35% of sperm showing good, normal forward progression about an hour after ejaculation. The average is usually around 50%. They often grade it on a scale like 0 to 4, and a score of 3 or 4 indicates good, strong movement.
Okay. What else is checked?
The pH level of the fluid, it should be slightly alkaline, between 7.2 and 7.8. If it's higher than 8, that might suggest an infection. Lower than 7.0 could indicate contamination of the sample or maybe blocked ejaculatory ducts.
Okay. And volume?
Volume is measured too. Should be more than 2 milliliters, which is roughly half a teaspoon, though the average is often a bit higher, closer to a full teaspoon, maybe 3.7 cc or so. Then there's liquefaction. This is pretty important. Semen starts out thick, viscous.
Right.
It needs to liquefy, become watery, usually within 15 to 30 minutes after ejaculation.
Yeah.
This watery consistency is crucial because it allows the sperm to swim freely. If it stays thick, that poor liquefaction can really reduce sperm motility and therefore fertility.
Makes sense. They can't swim through goo.
Pretty much. Then there's concentration, the number of sperm per milliliter. A healthy count is generally considered greater than 15 million per milliliter.
15 million per ml.
Yeah, though the average is often much higher, maybe around 70 million per cc. And finally, they often calculate the total motile count.
How's that worked out?
It's basically a calculation combining the concentration, the volume, and the percentage of motile sperm. You ideally want to see at least 20 million total motile sperm in the whole sample.
Okay, that gives a good overview of the standard test. What about more advanced testing?
Yeah, Dr. Werthman mentions things like the sperm DNA fragmentation analysis. This isn't usually a first-line test, but it can be a really valuable adjunct test.
Adjunct. So used in specific situations.
Exactly. It measures the level of damage to the DNA inside individual sperm cells. This can help predict how well those sperm will actually function beyond just looking at count and movement. It's particularly useful for couples dealing with unexplained infertility or recurrent miscarriages, or maybe those planning for IVF or other assisted technologies.
I see. Provides deeper insight.
It does. And for men whose sperm concentration is quite low, say less than 10 million per cc, endocrine testing is often the next step.
Hormones, right?
Exactly. A blood test to measure key hormones like total testosterone, LH, FSH. Those are pituitary hormones that signal the testes, plus estradiol, which is estrogen E2, and prolactin, PRL, another pituitary hormone.
And can finding issues there help?
Sometimes, yes. That's the good news. If hormone abnormalities are found, they can sometimes be corrected with medication, which can be a really effective way to improve sperm production or function.
Okay, so there are potential treatment avenues there. You know, what's truly remarkable about this chapter is just the incredible biological detail it dives into, some amazing physiology facts.
Oh, absolutely. It's mind-blowing stuff.
Yeah.
For instance, those coiled seminiferous tubules inside the testes, where sperm are actually made.
Yeah.
If you uncoiled them, they'd stretch out to about 27 inches or 70 centimeters.
Wow, packed in there.
Tightly packed.
Yeah.
And a healthy man's body is like this incredible sperm factory, churning out maybe 100 to 200 million viable sperm every single day.
Every day.
Constantly, at a rate of about 1,200 sperm per second.
That's unbelievable.
It really is. And crucially, optimal production happens at a temperature that's 2 to 4 degrees Celsius below core body temperature. That's why that heat factor we discussed earlier is so critical.
Right, keeping things cool is key.
Vital. Once the sperm are produced, they go on this journey of maturation and transport. They move into the epididymis.
Epididymis, okay.
It's this delicate, highly coiled tube. Get this, it's about 12 feet long if you stretch it out.
12 feet?
Yeah, all coiled up. And that's where sperm continue to mature and basically learn how to swim properly.
Takes a while, I guess.
It does. From there, they travel into the vas deferens. This tube is like a super efficient muscular pipeline. It actually has the highest ratio of muscle to internal space, 10 to 1 of any hollow organ in the body.
Why so muscular?
It's designed for really strong, rapid contractions to propel the sperm forward during ejaculation. And a lot of mature sperm are actually stored right there in the epididymis and the vas deferens waiting.
Okay. And how long does this whole process take, from making a sperm to it being ready?
The entire cycle, from the initial production of a sperm cell to it being fully mature and ready for release, takes approximately 64 to 72 days.
2 to 2.5 months.
About that, yeah. So things you do today might impact the sperm you ejaculate 2 or 3 months from now.
That's a really important point for lifestyle changes.
Absolutely. And when ejaculation happens, those mature sperm mix with seminal fluid. Most of that fluid, over 80% of the volume, comes from the seminal vesicles. Another 10–20% comes from the prostate gland.
And that fluid isn't just for transport.
Not at all. It's crucial. It provides nutrients to support the sperm's metabolism, helps their motility, and acts as a vital antioxidant, protecting them on their journey. It's this complex, perfectly orchestrated system, really, all designed for conception.
It's truly fascinating. Okay, so we've talked about the challenges, the biology, the testing. Now let's shift to the really hopeful part of this chapter, actually overcoming infertility. What actions can men take, and how is technology changing the game?
This is where things get really encouraging. For instance, Dr. Werthman talks about vasectomy reversal. About 500,000 men in the U.S. get vasectomies each year.
Wow, that many.
Yeah, and maybe 5% or so later decide they want to father more children. The good news is there are options. You can try to surgically reverse the vasectomy.
Is that usually successful?
Success rates vary, but it's definitely an option. Or you can use technology to extract sperm directly either from the epididymis or the testicle and then use that sperm for IVF with ICSI.
ICSI, we'll get to that.
Right. Or the third option is planning ahead. Freezing and storing sperm in a sperm bank before the vasectomy. Kind of like an insurance policy.
Smart thinking for some guys.
Definitely worth considering. And the advancements in assisted reproductive technologies, or RT, over the last, say, 30 years have just been transformative.
Like IVF.
Exactly. In vitro fertilization, IVF, especially when combined with something called intracytoplasmic sperm injection, ICSI.
Okay, explain ICSI.
ICSI is really groundbreaking. It's where embryologists take a single individual sperm, maybe from the ejaculate, or maybe one they harvested directly from the test.
Just one sperm.
Just one. And they use a microscopic needle to inject it directly into the egg to create an embryo. This technology means that men who previously had virtually no chance of fathering their own biological children, guys with extremely low sperm counts, terrible motility, or even esospermia because of a blockage, now have a very good likelihood of doing so.
That is absolutely game-changing.
It really is. The critical thing, as the 21st Century Man emphasizes, is finding expert physicians, a good team that can address both the female and the male factors when you're facing significant fertility challenges. It's very often a team effort.
That makes total sense. It's a couple's journey. Okay, so for those listening who are actively trying to conceive or maybe planning for the future, Dr. Werthman's chapter boils down to some really practical, actionable takeaways.
Yes, a great checklist.
First, stop smoking.
Not negotiable, really.
Also, avoid recreational drugs. Limit alcohol and caffeine consumption. Remember that heat factor we talked about?
Mm-hmm.
Avoid jacuzzis, hot baths, hot yoga, but hot showers are okay, right?
Hot showers are fine. Yeah, no need this effort.
Good. Eliminate unnecessary medications, like Propecia is mentioned, if you happen to be taking it for hair loss and are trying to conceive.
Right. Check with your doctor about any medication.
And this one needs repeating: absolutely no testosterone use.
It's worth saying again.
Mm-hmm.
It is a contraceptive in this context, not a fertility aid.
Got it. What else?
Be mindful of lubricants during intercourse. Avoid standard petroleum-based ones or anything not specifically labeled as fertility-friendly, as many common lubricants can actually harm sperm.
Okay, important detail.
Try to avoid keeping a laptop directly on your lap for long periods or your cell phone constantly in your front pocket. Again, it's about minimizing potential heat and maybe other exposures.
Makes sense.
When it comes to timing intercourse for conception, the advice is often to abstain for a few days before your partner's expected ovulation to build up the sperm concentration.
Okay.
But it's a balance. Don't abstain for too long, like weeks, because sperm quality can actually start to deteriorate if they're stored for excessive periods.
Right, a sweet spot.
Kind of. And finally, consider taking a high-quality antioxidant supplement. These can help protect sperm from damage. These are all practical steps you can start thinking about or implementing today.
That's a fantastic practical list. So, wrapping things up, what are the big picture takeaways here?
What's truly fascinating, I think, is just how common male factor infertility actually is, and how significant a role men really play in conception. It is absolutely not just a female issue, and just recognizing that is empowering for couples.
Yeah, absolutely. So what does this all mean for you, our listeners? I think the powerful message from this chapter is that many, many sperm issues can actually be significantly improved, maybe even resolved just through thoughtful lifestyle adjustments. These are real, tangible changes you often have the power to make.
And if those lifestyle changes aren't quite enough, it's just crucial to get tested. Don't wait too long. Consult with a specialist in male reproduction. Getting that early diagnosis and expert guidance can make such a difference.
And the truly incredible news, the really hopeful message, is that we live in an era where technology can overcome even the most severe cases of male infertility.
Amazing.
It allows most men the possibility of becoming fathers, which just gives immense hope and really expands the pathways for building a family. This chapter shines such a positive light on that reality.
Well, that was an incredibly insightful deep dive into staying fertile. Chapter 95 from the 21st Century Man. Dr. Werthman's expertise just shined through, doesn't it? Providing such clear, actionable advice on a topic that, let's face it, can feel pretty overwhelming.
He does a great job breaking it down.
Yeah. This whole book is just packed with essential information for modern life. We really highly encourage you to pick up a copy, read it for yourself. It's definitely a resource you'll want on your bookshelf.
Absolutely. Understanding these factors, knowing the solutions that are available, it's profoundly empowering, whether you're actively trying to conceive right now or just, thinking about your future health. Couldn't agree more. All right, join us next time on the 21st Century Man podcast. We'll be tackling Chapter 96, Understanding Health Insurance, another crucial one. You won't want to miss it.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.